Welcome to Tuesday's edition of COVID-19. The pandemic has been taking a toll on both fertility and mortality rates worldwide, with the phenomenon more pronounced in places that have been profoundly affected by the virus. Now, we have details on this later on the program. Here first are the COVID-19 updates with our Kwon So-ah. Now, So-ah, then, do start us off.
Sure, Sunny. Korea reported a slight drop in COVID-19 infections this Tuesday, with 1,202 cases reported as of 12 a.m. But that represents a drop in imported cases rather than domestic transmissions. Now, daily infections have been at above 1,000 throughout the past week, and with that, now for 28 straight days, the number has been at above 1,000. And Korea has now accumulated 202,203 infections in total. Cases in the capital Seoul have dropped this Tuesday, but there's been a rise in Gyeonggi-do province, a drop in Incheon, but then again a rise in Daejeon. So really not a dramatic change compared to yesterday, with infections still scattered across the nation. And that especially with the summer vacation being at its peak. So officials are warning that the peak of the fourth wave of the virus may still lie ahead of us if containment efforts become lax.
5.31 million vehicles were on the expressways last Friday, a record high for the summer vacation season. Please try to refrain from traveling during the remaining vacation period and use that time to rest instead of gathering with others.
Right, and so adding on to current concerns, a report of the Delta Plus variant here in the local front.
Right, Sunny. According to health authorities, there were 2 cases of the Delta Plus variant confirmed here in the country, which is a sublineage of the highly contagious Delta variant that was first detected in India. And one of the cases involves a person that came from abroad, but the other, a man in his 40s, had no record of traveling abroad. So that is a new concern and also another reason to get vaccinated. Meanwhile, here, if we take a look at the number here, the country has hit a milestone of 20 million people who got at least 1 dose of COVID-19 vaccine as of 10:20 a.m. this Tuesday. Now, beginning this Tuesday, meanwhile, autonomous vaccination reservations by local governments kicks off, and actual inoculation for that group starts on August 17th. Prioritized groups aged between 18 and 49 in the capital region can start booking at 8 p.m. this Tuesday, those outside the metropolitan area on Wednesday, and from Thursday to Friday nationwide. People subject to this group are essential workers, so like street cleaners, delivery workers, and public transportation drivers, as well as foreign laborers, exchange students, and people working at high-risk places. Meanwhile, abroad, there are more and more countries that are considering booster shots, especially due to the fast-spreading Delta variant. Some countries here, the UK, Germany, Cambodia, and also Japan, are considering to get booster shots for vulnerable people or seniors, while Israel is in the midst of vaccinating their seniors aged 60 and above. Let's also take a quick look at the figures abroad of infections. The U.S. is seeing resurgences despite new measures regarding face masks. Over 120,000 new cases were reported in the U.S. in the span of a day, while the UK, which has eased almost all of its lockdowns here, is seeing a drop in cases around 20,000 in the past day. And the total number of cases around the world stands at 199.5 million. Those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Right, on the local front, President Moon Jae-in has reaffirmed the country's pledge to offer 1 dose of the COVID-19 vaccine to 36 million people by the end of September. For more on this, I have our Kim Dami here in the studio with me. Welcome, Dami.
Good afternoon, Sunny.
Right, let's start with a fresh vote of confidence in the country's inoculation drive.
Sure, Sunny. So Korea is on track to administer at least 1 dose to 36 million people by the end of September. Speaking in a meeting with his top aides on Monday, President Moon Jae-in said that the government will do all it can to speed up vaccinations and reassure the public that no supply issues will be encountered.
내일이면 1차 접종이 2천만 명을 넘게 될 것입니다. 9월까지 3,600만 명에 대한 1차 접종을 마친다는 계획도 차질 없이 진행되고 있습니다. 목표를 앞당겨 추석 연휴 전까지 목표를 달성하고자 합니다.
Now, as a matter of fact, the country has now vaccinated more than 20 million people as of 10:20 a.m. this morning on Tuesday. And now this year's Chuseok holidays will start on September 18th. President Moon said that bookings for vaccination appointments will start next week for some 17 million people aged 40 and under. He also called on officials to make sure the registration system runs smoothly so that everyone can get a fair chance of booking their shots. The president further acknowledged that there's still a lot we don't know about the virus, but what's certain is that vaccines contribute to fewer deaths and hospitalization, calling on the nation's people to get inoculated.
Right, Tommy. Staying with vaccines, how are authorities here responding to news of price hikes by Pfizer and Moderna?
So deals to buy more vaccines next year could be affected by the price hike, but it will not affect the price of this year's supply as part of the terms of deals already signed. But with the government considering booster shots, given the threat of the Delta variant, Korea is negotiating with the drug makers for the purchase of additional vaccines in 2022.
The government has secured a budget for 50 million vaccine doses and is in negotiations to finalize the deal in the latter half of the year.
Going back to the price hike, both Pfizer and Moderna have upped their prices 25% and 13% respectively for their mRNA vaccines in the latest supply contract submitted to the European Union. Now, despite concerns over what this could mean for next year's supply of vaccines, Korea's vaccination campaign is picking up speed nonetheless. So starting next week, those aged between 55 and 59 will get the Pfizer jab regardless of where they are in the country. And the importance of vaccinations has been further highlighted after findings show that almost 96% of the new COVID-19 patients reported in Korea in May and June was unvaccinated people.
Right, Tammy. Meanwhile, so I mentioned this earlier on Monday, of course. I believe we surpassed, that is, a grim milestone with regard to total number of COVID-19 cases here.
That's right. So the total number of COVID-19 infections to date now exceeds the 200,000 mark. Fueled by the rapid spread of the Delta variant, the grim tally was reached just 4 months after the country passed the 100,000 mark in April. More than half of the new cases are from the capital area, but daily infections here fell slightly compared to the week before. The same goes for areas outside the capital region. The number of daily infections is dropping slowly, but it's still early to let our guards down due to the rising number of cases among those in their 20s and 30s. More than half of those cases came from small gatherings with family members, friends, and colleagues at the workplace. Young people, typically being the most socially active members of society, may also have played a key factor in fueling the latest outbreak.
All right, Tammy, as always, thank you very much for the coverage.
My pleasure.
Right, it's time now for the regular afternoon briefing on the COVID-19 situation here in Korea for this Tuesday. Now, efforts to contain the fourth wave continue nationwide up until this coming weekend. That would be Sunday. A vast portion of the country faces level 3 restrictions. Now, under level 3, a maximum of 4 people can meet socially, with an exception for family members who reside together. Granted, the family will be required to provide proof of this living arrangement. Events including weddings and funerals, as well as rallies, can host up to 49 people in attendance. Also, concerts will be allowed only at certified venues. Indoor stadiums can host 20% of their capacity, while their outdoor counterparts face a 30% limit. Places of worship can host 20% of their capacity, and outdoor congregations can have up to 49 people. Businesses, including dining and drinking establishments, as well as gyms and cram schools, need to close doors at 10 p.m. Meanwhile, here's a look at the level 4 social restrictions in place here in the Greater Seoul area, as well as a few other regions, also until the 8th of August. I understand the briefing's about to start. We'll come back to you afterwards.
First of all, we have Mr. Lee Sang-won with today's briefing.
네, 방대본 역학조사
I am
분석단장입니다.
director of the
8월
Epidemiological
3일
Investigation
코로나19
and
감염병
Analysis Task
정례
Force, and let
브리핑
us now begin our
시작하겠습니다.
regular briefing for August 3rd,
우선
Tuesday.
18세에서 49세
First of all, between the ages of 18 to 49, we are also having some updates on the vaccine booking. And in this, for these age groups, for these group of people, we are opening the booking process for the vaccination starting from next week, which is 9. And we also have designated 10 days for each group of people. And as for the eligible recipients, the people will be grouped, classified depending on the last digit of their birth date. And for instance, on Monday, starting from the 8 p.m., we will also have for certain days only the vaccination process open for those with the last birthday digits ending with 9. And also, we will have two groups, and each group will have each specific day for the vaccination opening, reservation opening, that is. And after a certain period of time, we will open the reservation for all group of people. And next, as for the Janssen vaccine, we have some updates in the criteria for use and the experts meeting on the vaccination. We have looked at the eligible recipients of the Janssen vaccines, and the group have said that the Janssen vaccine is based on the same platform of the virus vector platform, just like the AstraZeneca vaccines. And as for those above the ages of 50, and as for those over the 30. However, they cannot receive 2 doses of the vaccines. Only these group of people will be the eligible group, recipient group of the Janssen vaccines. And considering such recommendations, we will be reflecting these with the updates to our vaccination plan. And as for the latest Janssen doses that have arrived, we will be giving out these vaccines starting from next week to sailors, crew members, and also homeless people, and moreover, the essential social workers. And as for the AstraZeneca vaccines, we also have about 180,000 COVID-19 vaccines being delivered from the Andong factory, and tomorrow we also have about 2.5 million doses of the Pfizer vaccines arriving at the Incheon airport, and also the AstraZeneca vaccines. More vaccine doses will be delivered starting from tomorrow from the Andong facility, that is, and we will have a total of 28 million doses of the AstraZeneca, Moderna, and Pfizer vaccines to arrive here in South Korea within the month of August. And lately, as for some new cluster infections, we have some details. Lately, we have seen the educational facilities and workplaces which have been the culprits of the chain transmissions within the communities, and we would like to ask for these workers who are working at these facilities to take particular precaution. And we are seeing increased cluster infections among these facilities, which is also spreading to family members and also local community as well. And especially these family transmissions is also enlarging into other facilities, including workforces and other multi-use facilities, thereby leading to more cluster infections within the local community. For instance, in Jeonnam, Yeosu City, we have a company, and one identified COVID-19 patient went to a restaurant, and the virus has spread to his or her colleague and also workers, and it also spread to about 96 people across 9 multi-use facilities. And also in Daejeon, for instance, we have the Taekwondo Academy, and in this case as well, one of the staff members have shown symptoms including fever. Unfortunately, this person went to work and have come into contact with many people. people even after showing symptoms, and the virus spread to about 75 additional people, and a total of 254 people were infected in total, as there were some local transmissions as well. And both of these cluster infections, we have learned that these people at the initial stages of infection, even after showing symptoms, they visited at the workforces and they went to the workforces, thereby spreading the virus to many others. And as for the cluster infections, congested areas and that have poor ventilation, we would like to once again highlight the importance of abiding by quarantine measures. Moreover, if you have any suspicious symptoms of COVID-19, we ask you to refrain from visiting any multi-use facilities and get tested as soon as possible. And also, as for the critically ill patients in the age group of 40s and 50s, we have some details. And lately, we are seeing some people increase of the people who are seeing critically ill symptoms and also COVID-19 related deaths among these age group. And we have done some comparison, and of these 60s, we have seen about 8% range of the fatalities and also critically ill patients. However, on the 40s and 50s, we have seen a slight increase, which has jumped by about 5.5 times, and the fatality rate also jumped more than twofold. And so we ask for these middle-aged group to get the COVID-19 vaccines and moreover comply with the COVID-19 restrictions more stringently as well. And we would like to also note that the spread of the Delta variant could also pose serious challenges to these group of people. So we ask you to continue to abide by quarantine measures, including social distancing measures. And next, we have some updates on the new variant cases here in South Korea. During the past 1 week, we have looked at about 27.4% of these cases were under analysis, and about 57% of the imported cases were analyzed. And our genetic analysis shows that about 2,009 new cases have been newly confirmed, and also until now, a total of 8,125 new variant cases have been detected. And we have identified that 250 cases were imported cases, while more than 1,800 cases were local transmissions. And as for the detection rates, we have about 67% of these detection rate when it comes to new variants, and 61% for the Delta variant. And as for the Delta plus variant, which is a sublineage of the Delta variant, we have classified and identified 2 cases here in South Korea. One was an imported case, and one was found in a man who did not have any foreign travel records, and we are under epidemiological investigation. And aside from one additional family member, we do not see additional transmissions. And lately, we have seen an increase of the proportion of the Delta variant, and up until now, we have had the Delta variant PCR test, which have been used only temporarily. However, starting from the 1st of August, we will be using these on a large scope by the discretion of the local governments. And aside, on top of the 3 conventional variants, we will also enable a swift testing of the total of 4 variant types, including the more contagious Delta variant. And we believe that the government can also intensify its control and monitoring over these variants. And as for the breakthrough cases, we have also some updates. And as for July 29th, we have looked at
6,326명 중
about
돌파 감염
6.3 million vaccinated people, and we have seen about 0.01% of the breakthrough case, which is only about 1/5 of that of the US. And as for AstraZeneca vaccines, we have 254 cases, and Pfizer 284 cases, Janssen 258 cases, and also 10 people were cross inoculations, and we had 1 fatality, and also 10 people showed critically ill symptoms. And as for the 243 people we have analyzed further, 150 people have been contracted with the new variant, and a majority of them, about 128 people were infected with the Delta variant. Right now, in many other countries that have high vaccination rates, we are also seeing a fueling of COVID-19 infections due to this contagious Delta variant. And to this end, the South Korean government is also exerting our full efforts to contain and monitor such variant as well. And last week, we have seen a stagnant and a slowdown in the continued rise in the number of new infections. It is very fortunate. However, we cannot say right now that we are seeing a downward trend. It's too early to say this, and we still have much room and much possibility for the curve to also bounce back up. And next, we would like to also call on the public's attention on the importance of fighting the new variants, as this is more contagious. And we would like to continue to note that despite the highly contagiousness of these new variants, the vaccines can not only help you to prevent such infections, however, it can also clearly reduce the risks of critically ill symptoms and also fatalities related to COVID-19. And until we have the COVID-19 situation under control with full-fledged vaccines, we need to also have full-fledged social distancing measures and antivirus measures. Right now, we need to continue to exert more efforts. And as of today morning, 10:20, tentatively we see that as for the number of the people who have received at least 1 dose exceeded 20 million here in South Korea. And the government is also aiming to reach 36 million people in receiving first dose by September. And to this end, we ask you to participate in the vaccination drive on the day of your booking. And right now, the containment needs to have a clear downward trend of the virus and a flattening of the curve as well, further thanks to the COVID-19 vaccination and also continued antivirus measures. We need to call on the public support and participation. Even at this moment, we have many medical workers, volunteers, and also epidemiological investigators who are exerting their full efforts, even despite the scorching heat. And we would also like to thank the military personnel as well. The government will also exert our full efforts. Thank you very much.
Right, there was Lee Sang-won with Tuesday's afternoon briefing, and I have our Kwon So-ah back here at the desk with details of that address. Right, So-ah?
Right, Sunil. Let's focus on the variant updates. The officials said that 2,109 new variant cases were confirmed in the past week. So with that, Korea now has a total of over 8,120 variant infections. And out of the 4 major variants, the Delta variant made up the highest proportion. He also mentioned the Delta plus variants, which I mentioned before. There were 2 cases, according to him. And again, one was an imported case and the other was by a person who had no record of traveling abroad. And another family member of that person has tested positive for the virus, but it appears that it's not yet confirmed whether that's also a Delta plus variant. Meanwhile, he also said that in other countries that have high vaccination rates, there are resurgences, especially due to these variants. So he stressed that here in the country, the highest, the risk factor right now is these appearances of variants and also whether they will become dominant or not. So we should not lose our vigilance, although we are seeing slight declines in recent days.
Right. All right. So thank you very much for that.
Anytime.
Right. While information about COVID-19 is evolving, health experts agree people with diabetes appear to develop more severe disease. Now, we tell you why in this next report.
A fresh wave of COVID-19 infections is sweeping across the globe, fueled by the spread of the Delta variant. Amid the latest crisis, new research out of the US has made global headlines for identifying a possible link between diabetes and COVID-19 fatalities. A study presented at an annual meeting of the American Diabetes Association reported that 40% of all Americans who had died from COVID-19 either had type 1 or type 2 diabetes.
We know that some of it is that people with diabetes often have many other diseases, each of which increases the risk of bad outcomes with COVID. And we also know that people with diabetes have an inflammatory state. They have more likelihood for that kind of a problem. So you take people that are prone and have an inflammatory state, and you take a disease that gets really bad when the inflammatory system gets out of control, and that probably is another factor.
Korean health experts have also reported that those with diabetes were more likely to experience poor health outcomes compared to non-diabetic COVID-19 patients.
국내 5천여 명의 코비드19 환자를 대상으로 분석한 바에 따르면 당뇨병 환자인 경우 당뇨병이 없는 환자에 비해서 중환자로 기준을 잡는 기계호흡을 기준으로 하면은 1.93배, 즉 2배 정도 높고 사망률은 2.66배, 약 한 3배 정도 높다고.
These findings are especially concerning given the growing risk of diabetes being generally observed amid the pandemic. Experts say that unhealthy habits in diet and exercise caused by the pandemic may trigger diabetes in a larger number of people.
사람들의 체중이 전체적으로 증가하였습니다. 즉 비만이 생기면 이것이 당뇨병으로 이어집니다. 또 다른 이유는 혼밥, 혼술이 늘어나면서 불규칙적인 식사, 또 과다한 식사량, 그리고 본인이 좋아하는 음식만 먹는 음식 편식이 두드러집니다. 그리고 기존의 생활 패턴을 벗어나면서 심리적 불안과 깊은 수면을 할 수 없는 상황이 되었습니다. 심리적 스트레스와 불충분한 수면은 혈당을 올리는 매우 중요한 원인 중에 하나입니다.
Studies have also suggested that Koreans may possess genetic risk factors that make them inherently more likely to develop diabetes compared to Caucasians.
Compared with European descendant or Caucasians, Korean people have a significantly lower pancreatic volume and tend to have greater fat content in the pancreas. And these factors are associated with decreased insulin secretory function. And that's the main reason why Korean might have more risk in diabetes.
The WHO has also issued a warning of the danger that COVID-19 poses to those with diabetes, who number more than 400 million people worldwide, recommending them to get vaccinated and exercise rigorous prevention by wearing their masks and keeping their hands clean. Experts are also calling on extra precautions for diabetes patients to better manage their health amid the scorching summer heat.
당뇨병 환자분들께서는 백신에 대한 안정성에 많은 걱정이 있으시겠지만 접종 기회를 피하지 마시고 적극적으로 받으시라고 권고하고 있습니다. 따라서 당뇨병 약제 복용 및 인슐린 투여를 평상시보다 더 철저히 하시고 여름철에는 충분한 수분 섭취를 하시고 또 집에서도 매일 일정량 움직이시기를 권고드립니다.
Those with diabetes still have many options available to keep themselves protected from COVID-19, including vaccines, as well as tried and tested prevention measures in everyday settings.
이러한 인구 문제는 우리 경제사회 전반에 광범위한 영향을 미치는 심각한 사안으로서 경제부처, 사회부처가 따로 있을 수 없습니다. 전 부처가 전방위적으로 합심해서 대응해 나갈 필요가 있겠습니다.
低生育已经成为大多数发达国家普遍面临的问题，这也许将来也是中国要面临的现实的问题。
Mortality rates have surpassed fertility rates here in Korea, changing the national demographic portrait over the past 19 months. Now, meanwhile, over in the US, population growth is forecast to mark a halt for the first time this year amid the pandemic. For more, I have Professor Chae Young-jun from Yonsei University. Welcome back, Professor Chae.
Good afternoon.
And joining the session virtually is Professor Richard Carpiano at the University of California, Riverside. Pleasure to have you with us again, Professor Carpiano.
Thank you for having me.
We'll start here in the studio, Professor Chae. Let's begin with the reality that Korea's fertility rate fell to the lowest in the world last year. What are the demographic implications of this finding?
Well, actually, the situation is pretty, serious because our fertility rate has been low in G20 countries and also among OECD countries. It has been about 1. That means fertility rate is a kind of number of children per woman. Is a 1 means we should have at least the fertility rate is 2 to maintain the size of current population. The 1 means eventually our population will be halved. So this is a pretty the serious situation, and the low fertility rate actually influenced the aging issue. And our aging speed will be quite fast. For example, in France, the aging ratio, the 7% aging ratio would become a 20%. Then it will take about 110 years, but in Korea, it will only take 25 years. So I think this is a very serious issue. And also probably more serious issue is we have such a negative socioeconomic situation where young people actually refuse to get married and also have a child.
Right, unfortunately. Meanwhile, Professor Carpiano, over in the US, there is talk, like I said earlier, about a halt in population growth this year amid the pandemic. Now, how likely, Professor, is this scenario?
Well, indeed, the US population has been steadily growing in size, but the rate of that growth is a general trend past several decades, especially since the early 1980s and notably after 2016, after 6 years of being relatively stagnant. So from 2019 to 2020, the U.S. population showed the smallest rate of growth in at least 120 years, only 0.35%, which equates to about 1.1 million people, estimated at the time of about 329 in the United States. And so provisional data shows that the first 3 months of 2021, population actually declined relative to the same period in 2020. And so the U.S. population could shrink technically in 2021. And if so, that would be COVID deaths, low birth rates, and immigration restrictions. And so this really highlights growth is due to more fertility that's affected by these social and policy factors like migration. It's actually the third low as well.
And we'll get into that later on, of course. Professor Chae, what has been the impact, meanwhile, of the pandemic on Korea's fertility rate?
Well, actually, we don't have a statistics yet about how the COVID-19 actually influenced the fertility rate. We need to wait and see about 2021 statistics. But I think there would be a huge impact on the fertility rate. Our fertility rate is already 0.84, is the lowest. However, the reason why the young people refuse to get married and also have a child is because their job is unstable and income situations, and also, the social relationship is not that good in this time. But obviously COVID-19 actually kind of make the situation worse. For example, the young people really, they're struggling to get a job, and also income situation is pretty worse. And also, according to my recent survey, about 40% of people said they avoid meeting people and friends because of the financial reason. So I think that there's a problem of the social relationship, At the same time, according to the recent OECD report, the prevalence of depression was the highest in Korea in 2020, was about 37% around. So I think all these factors actually influence the young people's decision on having a child. So I think it will last, the impact would last quite long. So I'm pretty worried about this.
Right, and staying with the impact of the pandemic on fertility, has it been similar, Professor Carpiano, across the globe, or are some nations likely to witness baby booms while others are likely to witness baby busts, so to speak?
Well, there's similar number of countries that are showing very similar trends. So if we compare sort of 2019 and 2020 estimates, birth rates per 1,000 people declined in countries like Japan and France and Italy, for example. But these declines overall are larger historical of decline and relative stagnations. It's around the early 2000s or even before that. So it's just not suddenly just due to the pandemic. As was said, people don't often form families in economic uncertainty. We saw this in the United States during the Great Recession of 2007. So the pandemic economic toll, as well as social distancing, has certainly discouraged family formation. But larger population countries like the US and China are showing similar birth rate trends. However, China's birth fertility rate is very similar to Asian societies like Japan as well as Italy. And so these declining fertility rates really mean that, again, governments are really going to need to consider the extent to which their social policies are really supporting women and their partners as they confront career and family demands. So it becomes sort of a tricky policy situation.
Meanwhile, Professor Carpiano, what can you tell us about COVID-19's impact on global mortality as compared to previous pandemics, including the plague, smallpox, and the Spanish flu?
Yeah, well, one of the big impacting pandemics, of course, we think of is the 1918 plague, and that killed an estimated 50 million people. But this was when the world population was about 2 billion, where we're at about 7.8 billion today. So really, I mean, we're at a where any significant growth of the world's population would need to be due to more than just pandemics. But one way to kind of think about this is that population growth decline is really driven by 3 related factors: births, death, and migration. And infectious diseases can affect all 3 of those in direct and indirect ways. So overall, though, we could say it's unlikely that the COVID-19 pandemic will disrupt a long-term decline in fertility. We've now seen as a trend in almost all countries of the world, with the exception of some poorest countries.
Meanwhile, back here in the studio, Professor Shea, broadly speaking, what would be some of the tangible implications of a global population decline?
Well, I think not everything is negative. I want to say some good thing first. For example, we are talking quite a lot about the climate change and the environmental impact. Obviously, last 100 years, actually the population has increased dramatically. So I think the some population decline is not really the bad news to everybody. I think the reason why the Korea situation is serious is because the speed is quite dramatic. And also, if you look at the kind of education, job competition in Korea, it's a pretty tough. So I think the declining population would give some benefit to the planet and also the people living in there. But I think when you look at the economy and also the labor market, other aspect, for example, national competitiveness, decreasing number of children means probably that many people say actually we are kind of losing good human capital and the potential kind of talents, and that probably impact on the decreasing national competitiveness. And also, the small number of children probably support the elderly parents. I think this would create a lot of pain in terms of kind of a tax and public finance and so on.
Right. Meanwhile, Professor Carpiano, when then can we expect the globe perhaps to see a rebound in population?
Well, it's unclear. I mean, we have this ongoing trend of decreasing fertility. And so that was occurring long before the pandemic. So it's likely that we're going to see this trend occur long after the pandemic is brought under control. But irrespective of the pandemic, the population of affluent countries, including China, also decline over time. You have to recognize that. But while the fertility rate in many poor countries also declined, the world population will continue to increase, albeit be doing it at a declining rate. And so UN projections already are suggesting that global population will increase to about 9.7 billion by 2050. And again, this is about 6.8 billion now. So almost all the population growth, though, will be concentrated in Africa plus South Asia. We're going to be seeing some of these continuing trends long before and into the decades ahead.
I see. Meanwhile, back here on the local front, Professor Che, as you mentioned, another concern here is that Korea is the fastest aging country in the among members of the OECD organization. What are the economic implications, again, of this reality?
Well, again, I talked about, they're losing the talent, and possibly the decreasing national competitiveness could be one of the problem. And also, according to the projection, in 2050, the 40% of Korean population will be aged more than 65. So 4 out of 10 are elderly people. Thinking about our kind of old age poverty rate is the highest also among OECD country. 4 out of 10 is also poor, but the 40% of populations do not really have a good purchasing power. Then I think that's a kind of a direct impact on consumption, not only on the production side. So this is the one of kind of an impact we could think of. And also, the young people probably need to pay more tax and social contribution to support the elderly population. That means also they're losing their consumption power as not only the older generation, but also younger generation. They're also losing the purchasing power. I think these are all kind of impact the Korean economy.
Right, and beyond national boundaries, Professor Carpiano, what can you tell us about the economic repercussions of shrinking populations within advanced nations?
Well, the projections for the coming decades are not indicating much change in the situation of the declining fertility that we're seeing and population. Well, it's not necessarily a crisis when you think about climate change and other challenges to our globe that we're all going to face in the years ahead. So for some nations with older populations, as was said, it may present some challenges for funding our social programs because a large proportion of funds come from people working age. But immigration policies really are then going to be key for attracting people in fertility age. And even, technological innovations in forms of automation, robots, even break some of the existing ties for many decades between population growth and economic growth.
I see. And staying with that, Professor Che, what social safety nets are in place here in the country to accommodate our aged population?
Well, we introduced a pension system and long-term care system for elderly people, but very late compared to the other Western countries. So we have a good, relatively, we have a set of the pension system and the long-term care system, but the systems are not matured yet. So still we have some kind of holes here and there. That's why our poverty rate is high. And then also the older people need to work longer than before. However, our active labor market policies like training policies and labor market programs are not really good enough. So the people still retire their primary job at very early age, and I think this is another problem. So we have overhauled our social security and also labor market program quite a lot.
Right. And over in the US, Professor Carpiano, do you foresee the promotion of population policies to ensure perhaps a more stable demographic structure there?
Well, I certainly hope so. Immigration is very important for any country's economic growth. When we think about the United States, enjoyed a long history of benefits from immigration, not just in terms of providing workers and labor supply to meet demands of various sectors here, but in terms of promoting innovation that have made it a global leader. And so also, immigration is very much part of the American cultural identity. The cultural diversity of the U.S. has been a key feature and a strength, in essence, of the United States. And so any sort of highly restrictive immigration policies that might exist or that could be promoted would not only be bad for the U.S. economy, but really sense contrary to the idea of the United States being a melting pot, reduces its national identity. And so really we're going to need smart immigration. Those are going to be essential to ensure that there's enough engage people in the population to support older, non-working people.
Right, essential policies were very important. And very briefly speaking, back here in the studio, Professor Che, what are your thoughts on the key factors that may serve to shift the structure of the global population in the months ahead?
Well, I think the COVID-19 surely would have a big impact on the global population. So how to deal with this COVID-19 situation and get vaccinated, I know this is a very important issue. And at the same time, in general, I think we need to invest more in young people and the women. I think this is the key issue now.
Right. All right, Professor Che, thank you very much
Thank
for
you.
your insights.
Thank you.
Professor Carpiano in the US, thank you for being with us today. The audio would have been better though, because sometimes we lost you while you were speaking.
Oh, nuts. Okay.
Right, but thank you very much. Well, that brings us to the end of this edition of COVID-19. Do seek to abide by prevention measures and testing should you believe you may have been exposed to the virus. Thank you for watching.